After Scott Brown's recent victory in the Massachusetts Senate race, and Indiana Senator Evan Bayh's announcement that he will not be seeking re-election, it's becoming obvious that President Obama and his allies in Washington are running scared. This shift in power has meant that Democrats can no longer ram their proposals through Congress in defiance of the public will. And that realization has led the White House to acknowledge that they'll need to work with conservatives to accomplish big goals like health care reform. Or at least it's led them to say they realize it. The first step in this new era of temporary bipartisan cooperation is set to take place next week in Washington, when President Obama hosts a group of lawmakers for a discussion about the next step in the health care debate. Given that there will be only 9 Republicans in the room, we're not seriously expecting a plan that Milton Friedman would love. And while we expect several ideas to be offered at the summit, we'd like to stress the need for one in particular: tort reform. Tort reform is desperately needed whether any other legislation moves forward or not. This shouldn't be a tough sell for the president. After all, back in September, Obama acknowledged before a joint session of Congress that the costs of defensive medicine were one of the factors driving medical inflation. On that night, he announced that he was directing the Department of Health and Human Services to allow pilot programs that would test the effects of tort reform on keeping down medical costs. Only a few months later, however, spokespeople for HHS have told members of Congress that medical malpractice reform is not a priority for the administration. Which is it, Mr. President? We hope to see the White House come down in favor of letting states try this approach for themselves. But we'd be even more delighted if they paid attention to the results in places where the effects of tort reform are already conclusive. In California, where malpractice awards have been capped for 35 years, doctors' premiums are as much as 50% lower than in the rest of the nation. In Georgia, where a cap was put in place only 5 years ago, medical lawsuits have dropped by nearly 40%, and doctors have seen an 18% decrease in their insurance rates. Texas has seen a 50% drop in medical malpractice rates since enacting tort reform in 2003. In fact, efforts in the Lone Star State have been so successful that their neighbors in Oklahoma have started complaining that they're in the worst of all possible worlds. They've lost all of their doctors and gained all of Texas's trial lawyers. Over 90% of doctors admit to practicing defensive medicine, focusing just as much on preventing lawsuits as on preventing disease. With a recent House study showing that tort reform could eliminate over $200 billion a year in medical costs, no plan for cost-effective healthcare reform can be serious without an emphasis on getting medical care out of the courtroom and back into the doctor's office. If President Obama is serious about bipartisan cooperation, he'll take these factors into account. If he doesn't, he'll be guilty of professional malpractice of his own. That's this week's Freedom Minute.